Joining me now is Dr. Paari Gopalakrishnan. He is the Chief Medical Officer at Kent Hospital. Thank you so much for joining us today.
Thank you for having me.
Let's talk a little bit about ventilators. How many ventilators do you have at Kent Hospital? Do you have enough, and do you intend to get more?
So it's a great question. I can tell you over the last 2 months, we've been preparing constantly for this. We have been working on increasing the number of ventilators we have. We've essentially more than doubled the number of ventilators we have. We've been working with our state to try to get more through their stockpile. We've been trying to buy more as well to continue to increase. Because what we've seen across the globe is that is one of the things that can become in shortage. And so we've been augmenting as best we can. We also have anesthesia machines that we can supplement our ventilator ability. And we've also acquired what we call vent splitters. So we'd be able to take one ventilator and if we need to, let two people use it at the same time.
Is that considered safe? Do they ever do that?
So the ventilator splitting is relatively new. People have probably seen it on the news. It's essentially a last resort where we don't have any other ventilators. So I hope we never get to that point, and that's why we've been planning for the last 2 months to increase the number of ventilators we have, so we don't have to get to that part. But if we do, we'll be prepared.
Okay, let's talk a little bit about the actual ventilators themselves. I've seen pictures. They're very complicated looking pieces of machinery. Can you explain, as a doctor, how do you use a ventilator? How does this work?
Yeah, they're definitely complicated, but in principle, they're simple. It's basically somebody cannot get their oxygen level up. They can't keep their oxygen level up because they have an infection in their lungs or any other reasons. And all a ventilator does is be able to supply oxygen into our lungs. And it allows us to do that when the person might not be able to breathe on their own. And so we're able to put a tube down their throat, and all a ventilator does is push oxygen in and draws out carbon dioxide, just like we would if we breathe. And so that's the basics of a ventilator. There's a lot of technical aspects of how much oxygen do they give, how much volume, how much pressure. Those are the technical aspects, but in principle, all it is our patient cannot keep their oxygen level up in an appropriate level, and so a ventilator helps assist us to do that.
Okay, what is a normal amount of time that someone would stay on a ventilator?
It's a very good question, and it varies by person. It varies by what disease process is happening, and so it's dependent. A lot of times, people go on a ventilator, and we're able to get them better within a day to at least get the ventilator off of them. What we are finding, looking at COVID in particular, is that people are going on ventilators, and usually we would hope to get a patient off the ventilator in 2, 3, 4 days. These patients are staying on the ventilator for 7, 10, 15 days. And what that means for us, about the number of ventilators we have, is essentially once somebody needs a ventilator for COVID, they're using it for sometimes 2, 3 weeks. And so we start, the number that we have to spare goes down because of that.
Dr. Paari Gopalakrishnan, thank you so much for joining us today and sharing your insight and your medical expertise with us today.
Take care.